Our second ask is for a senator to introduce H.R. 1848, the Veterans Affairs Medical Scribe Pilot Act of 2017, which passed the House by a vote on July 24, 2017. In your meetings with representatives in the House, you can thank them for passing this bill. The Prohibit Smoking at VA Facilities Act, which STS advocates spoke to their members of Congress about the last fly-in, was rolled into H.R. 1848 this summer. This bill would prohibit smoking all tobacco products, including cigarettes, e-cigarettes, cigars, and pipes, in Veterans Health Administration facilities, including medical centers, nursing homes, domiciliary facilities, outpatient clinics, and readjustment counseling centers. We now need the Senate to take up the cause. This legislation would correct our current failure to protect veterans from the dangers of smoking and secondhand smoke. Tobacco use is the leading preventable cause of illness, disability, and premature death in the United States. Smoking is responsible for 1 in 5 deaths, resulting in approximately 443,000 avoidable deaths per year. These rates are disproportionately higher among veterans because both active duty personnel and veterans are more likely to have ever smoked or to currently smoke than the adult civilian non-veteran population. Partly due to this increased rate of smoking, veterans face a higher incidence of lung cancer than the civilian population as well. Studies have shown lung cancer rates among veterans are 25 to 75% higher than the national average. The Surgeon General has determined there is no safe level of exposure to secondhand smoke. Yet sick and disabled veterans are consistently subjected to secondhand smoke in order to receive medical care. Providing a smoke-free VHA system for our veterans is an important step towards protecting the people who protect us. Besides lung cancer, many veterans suffer from chronic obstructive pulmonary disease, hypertension, and coronary artery disease, all of which are exacerbated by secondhand smoke. VA facilities should join the thousands of hospitals, health systems, and clinics nationwide that have decided to protect patients with smoke-free campuses. This bill takes a bold step towards protecting veterans' health by banning all smoking in all VHA facilities. In the early 90s, the tobacco industry created a public relations-focused grassroots veterans opposition group that lobbied Congress to pass the Veterans Health Care Act of 1992, a law requiring that VA facilities have smoking areas. Arguing that it would be unpatriotic to deny veterans this freedom, industry consultants protected tobacco industry profits at the expense of veterans' health. Currently, the VHA maintains 15 indoor smoking areas at its facilities and 971 outdoor designated smoking areas. In co-sponsoring the Prohibit Smoking at VA Facilities Act, Representative Phil Rowe, a Tennessee Republican, physician and chairman of the House Veterans Affairs Committee, said, "The health and well-being of our nation's heroes should always come first." This common-sense legislation would bring VA smoking policies into the 21st century, ensuring veteran patients receive the same consideration as patients in the private sector. Since Representative Rowe's bill was included in the Veterans Affairs Medical Scribe Pilot Act, we hope you will ask your senators to introduce and co-sponsor this critical legislation.